Dr. Weinberger holds a master's in physics from Columbia, an MD from Harvard, and a PhD in immunology from Harvard as well. He's board certified in cardiology and interventional cardiology. He holds 19 issued US and international patents in the field of interventional cardiology. He currently practices as a cardiologist with rights at New York Presbyterian Hospital, Columbia University, and NYU, and is a clinical associate professor of medicine at NYU. He has been on the editor of over half a dozen journals, including the Journal of Cardiovascular Pharmacology and American Journal of Therapeutics, and has played a role on many advisory boards, including the Scientific Advisory Board for the International Academy of Cardiology. He is currently the Dean of New York School on Career and Applied Scientists. So, Rabbi Krupka, if you're listening, you mentioned it. It is close to impossible to discuss Dr. Weinberger's many accomplishments. Since obviously when we first spoke with him, we were wondering, is he really someone qualified to speak for the JPM? And the answer is yes, obviously. Obviously, yes. No questions asked. But seriously speaking, aside from his extremely impressive career in academic excellence, we are here tonight to discuss spiritual growth, for which Dr. Weinberger is also well known for. Please welcome to the podium, Dr. Weinberger.
Thank you very much for that over-the-top introduction. And wonderful to see the next generation of young physicians in this room. I can tell you that I never have seen, when I was in medical school, in one place, such a large group of probe observant physicians in one place. Obviously, Boston was a different kind of place than New York, very different than the medical schools that you go to. Usually I spend a bit of time talking to people about how you stay frum in medical school. One of the biggest parameters having to do with staying frum is being in an environment with other Orthodox students. You've all gotten past that hurdle. You're at schools where there's a significant frum population, but as you'll see as you go into your clinical years, the clinical experience is very immersive. That means that you are working with people who are not Jewish. You're working intensely and for many, many hours a day, and it's really easy. It's really, really easy if you're not grounded with the frum community, you sort of float away. Now, I'm sure none of you believe that can really happen, but when you're in a clinical environment and you're on call and you're spending 30 hours in one place, and you're working with people who have no understanding at all of what it means to be a frum Jew, it's very easy to sort of cut back a little bit on tefillah, cut back a little bit on learning, if you're doing some learning. As my Rav told me once, the Rav in our shul used to be the Rav at Einstein, he said that he tells medical students even 5 minutes a day is infinitely more than 0 minutes a day. So that when you get into your clinical coursework and you think you don't have time, you've really got to make a little bit of time to maintain that connection to Torah. And it's really that connection to Torah and to Yahadis that I'm here to talk about today, because it doesn't come automatically when you're a doctor. You're going to be choosing your clinical specialties as you go through medical school, and what kind of physician you become will determine the nature of the nisyonos you're going to be presented with, both in terms of training. If you decide that you want to become a neurosurgeon, you can expect different nisyonos than if you decide that you want to be a dermatologist. All right? And that's not to say that one has intrinsic superiority over the other, but to the extent that that's a piece of your cheshbon, be aware of it. But I'm really not here to talk about the medical school experience, but the bigger experience with a bigger understanding of what it is to become a doctor in terms of a frum person, not becoming a doctor, but being a doctor. So David Melech tells us in Tehillim, Sur Merov Aseita. So a lot of halacha in medicine has to do with the Sur Merov part, and I'll talk about that. I also want to emphasize V'asei Tov. Each of you have a tremendous opportunity to do Kadesh Shemayim on a daily basis, especially when you're in your clinical environment. And it does not take much to be a very, very special caring physician compared to the baseline, because the baseline is really quite low. So I urge you all to think about virtually every interaction you have, not just with a patient, patient's family, another physician. Each one of those interactions are an opportunity for you to be aware that you are a representative of the entire Jewish people in the eyes of anyone else, in the eyes of any guy. Whether or not you look like a Hasidic Yid, or you look like a guy with a yarmulke who's wearing, who's a very modern looking guy, they don't make a difference. They really don't. Each one of you is the totality of Judaism. And if you are a mensch and you exude caring for your patients, you're automatically, of course, assuming you're competent, you will automatically be Mekadei Shem Shemayim. So I just want to put that out there. You have a tremendous opportunity to say tov. So being that the focus of today's discussion about medical halacha, I thought I would present a couple of shilas which came up during my clinical experiences. Some of it happened in medical school, some happened when I was a resident, and some of it happened even when I got out of training. So one shilah that I remember speaking about, well, just when I trained in Boston, so I was what they call preparation H. I went to medical school at Harvard, and I was a resident and fellow there. So I was sort of stuck in that environment. And we had wonderful Rabbanim in Boston. I mean, we had Rav Soloveitchik, we had the Boston Rebbe, we had Rabbi Yehuda Kellermer, Zechron Bracha, Rabbi Saditsky was there. There were a lot of people who were notable post him. For a lot of reasons, I was able to ask a lot of shilas to Rabbi Kellermer, Zechron Bracha, who really guided me in my initial experiences. But then subsequently, I went to a Rav whose shul I davened in. So I happened to be davening by Rabbi Tversky, the son-in-law of the Rav. So it was very, very important to me to have access to Rabbanim to be able to ask shilas to. So one memorable situation was there was a young man in his early 40s who was dialysis dependent, and this person was extremely non-compliant. That means sometimes he wouldn't show up for dialysis. And the kidney doctors hated him because he totally messed up their schedules. He was a very difficult person to deal with. By Hayom, this guy has a cardiac arrest right outside the dialysis center. So obviously they try to resuscitate him, and they bring him to the ICU, where I was the accepting intern. He was intubated, and now the question was, what do we do with this guy? Do we dialyze him? The nephrologist came by and they said, we will not dialyze this guy under any circumstances. He's dead, he's dead. I mean, that was basically what they said. It was unclear by any criteria if this person was brain dead. By any criteria. You can't make that determination immediately after a period of lack of circulation. You just can't determine that. The Harvard criteria specify EEGs at 72 hours, but whatever it is, and we'll talk about whether or not brain death is the criteria, but there was no way of determining what this person's prognosis was immediately after. And he clearly needed dialysis. So what I did was, as an intern, I didn't ask anybody any permission. I bled him for a unit of blood, and I sent it down to the blood bank, and I said, wash it out, and then send it back up. And the round trip took about 4 hours. I was able to do that twice before my time was up. Then I realized, have I committed him to a treatment that I am now the only person who can possibly supply? In other words, as you know, you're not allowed to withdraw a treatment from somebody with a life-saving treatment. Is this equivalent to a person on a respirator that I can't stop? Or is this like an episodic treatment that each treatment is an independent zach, and I have the right not to be there for that subsequent treatment? So I asked my father, who was a Rav at the time, and my father was unwilling to paskin the shaila, and he asked his posek, who was a very well-known posek here in New York, and he paskined for me on this shaila, which we can talk about another time, but the point is that I was not ready to paskin this myself. I was not ready to decide, I can walk away from doing this or not. So the long and the short of it is this person didn't survive. But it was not for lack of dialysis, at least in that particular case. Another another event that I remember pretty clearly was we admitted a young woman who had acute leukemia. She was in her early 20s, and she was in for induction chemotherapy. I don't know, if I'm saying things you have no idea about, just raise your hand and I'll explain it a little better. She had an acute leukemia. She was in her first round of treatment. She has just gotten her first round of treatments. And after treatment with chemotherapy, usually the white counts plummet, and the person is severely immunocompromised, and the bone marrow is severely suppressed. So she had no platelets, she was severely anemic, and she came in with what looked like meningitis, but her hematocrit, her red blood count was so low that we needed to transfuse her. Because these people get transfused all the time, they develop a lot of sensitivities to other blood types. And cross-matching her, she cross-matched to a particularly unusual kind of blood. The hooker in this case was that there was another person in the hospital who was an alcoholic, who had had 4 previous admissions for bleeding from varices. Varices are these big fat blood vessels in the esophagus. When they start bleeding, it's very, very hard to stop. And frequently alcoholics take 6, 8, 10 units of blood to stop their bleeding if it stops. So the question was, the person who was taking care of the alcoholic reserved all the blood in the blood bank of this type, which turns out to be the only type of blood that could save this woman with leukemia. And the question was the hold that was placed, was this a case of 2 people in the midbar with 1 bottle of water, and each one, and the person who had he had a chazaka on the reservation of the blood. And this is not something that you want to really poskin for yourself at any time of the day or night. But I think that the last Shiloh I wanted to present to you was a Shiloh that happened at 3 a.m., which is a particularly bad time to need a Shiloh to be answered immediately. So, as a practicing cardiologist, I'm an interventional cardiologist, and although I've done my best to stay away from the portion of heart transplantation that happens before the transplant, where we assess people and decide who gets the heart and who doesn't, I've always been involved in taking care of people after heart transplantation, doing the biopsies, deciding how to manage some of their immunotherapy. Well, because there's a shortage of available hearts, it's become the practice to assess people who have agreed to donate hearts if they're older than 40 by doing an angiogram to assess whether or not those hearts are good hearts and can be used by other people. As you might imagine, hearts are very, very valuable commodities. And it happened once at 3 o'clock in the morning, I got a call that there was a woman who had had an intracerebral hemorrhage. She had a stroke, and I was told that she was brain dead. And they wanted to assess her heart for donation to somebody who was in Albany who needed the heart to survive. So there was somebody in front of us, so to speak, who needed this heart, and they were going to take the heart from this donor if the assessment of her coronary situation was such that there were no significant blockages. So that was the premise. So I get called at 3 o'clock in the morning. I'm on call for the cath lab. Weinberger, come in, do an angiogram on this lady, tell us whether or not her arteries are okay. So here we have, I'm being asked, number 1, to do a procedure on a person for whom there is no potential benefit. This person is not going to benefit by the procedure that I'm going to be doing, number 1. Number 2, am I allowed to do a procedure to tell doctors to take out the heart? Those are just a couple of the little problems that occurred to me at 3 o'clock in the morning. I did not feel comfortable at 3 o'clock in the morning calling up a Rav and asking the Rav what to do. So I did the angiogram. Now I'm going to digress now and say a couple of words about dealing with posting, because this is really probably one of the more important things that I've learned. So I this was really bothering me after I did it. I didn't know whether or not I had done the right thing. And I happened to be at a chasana, and two poskim, respected poskim, were at the chasana. And I went to the first posek, and I start talking. And he interrupted me. He says, "You know, we don't believe in brain death." I said, I know, Rebbe, I know. He said, "You don't believe in brain death." He said, "Okay." So she wasn't dead. So I said, "Am I allowed to do an angiogram on this person for the benefit of somebody else?" He said, "Let me see." He said, "If you tell them that the heart is good, they're going to open up her chest and take out the heart." I said, "Yeah." So he said, "Okay." See, he turns around and walks away. I sort of lost my appetite at that point. Then I saw another person, and I said, maybe I'll get a different sock. I don't know. I just needed an eitzah to know how to deal with this situation. I got no eitzah from the first posting. Second posting, tell him the exact same story. He says to me like this. He says, "Let's see now. Was the only organ that they wanted to take out of this woman the heart?" I said, "Of course not. They wanted the liver, they wanted the kidneys, they wanted the lungs, they wanted the corneas. There were a lot of organs to take, and they were all being donated." So he said, "And if you would have refused to do the angiogram, what would have happened?" I said, "They would have taken out the other organs." So he said, "Therefore, by you doing the angiogram, it took another hour and a half before they started taking out the organs." I said, "Yeah." I said, "That sounds like Chai Yeshua. It's a big mitzvah." All right. What was the nafkamina? Nafkamina was how much of the mitzias each posek dived into asking about. Now, when I asked the shaila, I did not make the cheshbon that the second posek made, and I only knew to present what I presented to the first posek. So it's important to have a posek. It's important to know what are the critical parameters of asking a shaila. I can't emphasize to you how difficult it is sometimes to know halachically what to do and how important it is to have a person to turn to. Fortunately, there are people who have, there's a large body of medical halachic knowledge, shilas and shuvas, which have been paskin, and there are rabbanim who specialize in this. I understand Rabbi Scrum will be talking a bit about this. It's important for you to have a halachic background to know what's even a shilah. Because some people don't even realize that there's a significant shilah on the table. So with that, I'd like to stop and ask Rabbi Scrum to say a few words regarding giving us a background in medical halacha and hopefully making us all not just responsive to medical halacha, but also people will understand that if you're following an absolute ethical and religious framework, you'll understand that this is not something that you're deciding by the seat of your pants. Making that kind of decision is frequently what happens in a clinical environment, but not one that leads to very much respect. I just want to close with a Gemara. I don't know if any of you are learning Daf Yomi, but we just had a pretty famous Haggadah where there was a discussion about two Amoraim that everyone knows, Abaye and Rava, and then there was a person who was a proto-physician, Abba Umna. Abba Umna was a person who was a Makiz Dam. He was a bloodletter. So the Gemara says that Abba Umna used to have a visitation from Shemayim. Rashi says there was a bas kol that called out to Abba Umna every single day. Abaye used to get a bas kol once a week, and Rava got a bas kol every Erev Yom Kippur. So Abaye had tremendous chalishas hadas. He was extremely upset about how this doctor, so to speak, this surgeon, whatever you want to call him, bloodletter, why it was that this person was getting this visitation from Shemayim, this tremendous cover. So he sent people to observe what was going on by Abba Umna. So the Gemara explains Abba Umna did a number of things which were way ahead of his time. He had a different waiting room for men and women. When the woman needed hakazah stam, when she needed to be bled, he had a special kind of covering with an opening that he was able to put his instrument through so that she was entirely covered up during the time he was makiz dam. When the procedure was over, he didn't collect his fees. There was a big barrel outside of his office, and people would put their fees in, and nobody would pay attention to who is putting the fees in. And finally, he refused to take compensation from Talmidei Chacham. So I'm not telling you that these are ways that you should particularly practice medicine, okay? But what is important is that each one of us has a unique way, has a unique possibility of being Mekadesh Shem Shemayim by what we do, how we do it, and by the thought that you put into how you do it. So, you know, I can't tell you that. I'll just give you a small example, not having to do with Yiddishkeit. You know, in the United States, you see people from different cultures, and you have to be sensitive to their backgrounds. So when I see a person from a Russian background and they're telling me they have chest pain, it could be that they're having coronary pain, but it could be the equivalent of a headache for an American or a stomach ache for a kid in school. You know, when kids get nervous, they get stomach aches. I don't know if any of you have stayed home on the basis of a stomach ache when you were in 4th grade, but each one of us has a background, and each one of the patients has a background. And your sensitivity and how you interact with them can reflect tremendously positively on Yiddishkeit and on yourself. And my brother to everybody is that you should grow up to be caring physicians and bring lots and lots of covenant to Kodesh Baruch Hu by what you do.
Thank you, Dr. Weinberger, for the insightful words. I think you really highlighted the importance of being able to find a posting, being able to find a direct posting, and that's something that we strive for and trying to encourage amongst our members.